Senator Kathy Sheran is here to talk about the issue of health disparities in Minnesota. Thanks for joining us. We appreciate it.
I'm glad to be here.
Senator, you just held a hearing on this issue and stated that there's this goal of health equity. How achievable do you think this goal is?
Well, the data indicates that there's a great disparity between certain groups, populations, African Americans, Indians, the new Somali community, new immigrants, healthcare outcomes, and the general population. So when we're sort of bragging about how well we're doing in terms of improving people's life expectancy or reducing the number of birth deaths, we're talking about some of us, but not all of us. So this year, we've had this hearing, as a matter of fact, the hearing was today, to take a look at not just the existence of the problem, but what can we learn from certain groups in our community that work with groups that have disparate health outcomes to change that. And I think we can achieve movement if we focus on what it is that will change that rather than simply spend our time describing the problem.
So what are some of the things you think can motivate change? What are some of the things that do have to change?
Well, first of all, the legislature has to understand that being able to change a person's health status is more than simply having them come in and see their physician and have some kind of a antibiotic if they have an infection. There really has to be a cultural change in the community that the person lives in and opportunities to do the things that result in health outcomes, that it is a broader issue than simply getting medical intervention. That's what we heard today in committee. It's about being able to have a job that earns enough income so that you can afford safe housing that's environmentally clean, that there's enough income in the family to buy food that's healthy for the person to eat, that the state of Minnesota doesn't implement economic development policies that create an environmental problem for certain neighborhoods, that create lung disease or other kinds of problems for specific populations who are poor. So what we need to take a look at is not just access to a physician for medication or health care, but also to those things environmentally that create an environment that health can occur.
Health Commissioner Ed Ellinger stated that African Americans, as you talk about health status, have essentially twice the unhealthy lifestyle as whites. What do you think this means for the state?
Well, we do know, not just in healthcare, but in terms of incarceration across the board, African Americans have very, very different kind of picture than whites. So what this means for the state is that we have to deal with the consequences of that in our budgets. We have to pay for the consequences of a whole population of really capable, competent people who we're not investing in. Instead, we're having to pay for the consequences of not making that investment. The public gets frustrated with that. The public doesn't like having to use its resources to make up for crime or to make up for chronic disease problems or chronic chemical dependency problems or other kinds of problems. They don't like having to sort of get at that end of the continuum. But if we don't want to spend our money there, then we have to spend our money on those things that will create health equity for everybody. And that includes a neighborhood that's safe to live in, a neighborhood that has affordable and clean housing, a job for somebody to be able to earn enough income so that they can purchase quality food. Those are the kinds of things that we heard this morning contribute to the reduction of health disparities.
So, Senator, what kind of a price tag do you anticipate with this? And it's not a budget year. Do you think you can move this forward?
I think there are elements that we'll have to focus on this year. There are things that can be done administratively, for example, that will not require any expenditure at all. And an example of that might be how we distribute the grants and what we expect of a grantee, recognizing that there are certain communities that can come forward and with that money have access to a community we'd like to change their health disparities. They might not be the traditional model, they may not be the Western model, they may be a new model. And so there are administrative things that can be done in granting resources to those organizations that really have access to this community.
Is that where you plan to go first?
Absolutely. I think absolutely administrative changes are the easy ones to do. those are the ones that we can do off the top because they don't have dollar signs associated with them.
So, Senator, in addition to these administrative fixes you're talking about, what else can be done?
Well, the system has to be changed. As I said, we need to take a look at how we implement grants, who we hire in our departments to make sure the voices of special communities are heard so that we listen to how to approach those groups. But then there are other things that I heard this morning, and that is that in order to work with these special communities, you have to develop a trusting relationship. And until you establish that, the capacity for us to change the health disparities doesn't exist. We don't reimburse for time that it takes to develop relationships in healthcare. So we need to take a look at how are we going to be able, maybe through the accountable care organization model, where you bundle resources and say, serve a population with all of this money, and you decide how to utilize it best, so that we can reimburse those things that need to be foundational in developing an environment in which that community comes forward and seeks the information they need to reduce healthcare disparities.
And again, it's a short session. Can you accomplish a lot of these, do you think, in 2014?
Our goal is not to accomplish major change in 1 year when you're talking about cultural change and health disparities. This is the beginning of a process that will take a substantial period of time and commitment over a long period of time from the legislature.
Okay, Senator Kathy Sheran, as always, thank you for coming in and sharing your perspective on this issue. We certainly appreciate it.
Thank you.